irregular periods, acne, facial hair growth and sudden weight gain. जब आप ये सब सिम्टम्स के बारे में सोचते हैं तो क्या आपको लगता है ये PCOS के वजह से हैं? आई एम श्योर आप लोगों ने ऑनलाइन सर्च किया होगा एंड दे बी मल्टीपल कॉजेज जो आपको मिले होंगे, जैसे थायराइड हार्मोन डिसऑर्डर, प्रोलैक्टिन हार्मोन डिसऑर्डर, लाइफस्टाइल चेंजेस, स्ट्रेस, ईटिंग डिसऑर्डर्स, बट इन सब में से कॉमन है PCOS। पॉलीसिस्टिक ओवेरियन सिंड्रोम क्या है PCOS? किस रीज़न की वजह से ये होता है? इसके सिम्टम्स क्या हैं? लॉन्ग टर्म कॉम्प्लिकेशंस क्या हैं? हम इसे कैसे डायग्नोज कर सकते हैं और इसका ट्रीटमेंट क्या है? आइए हम इन सब चीज़ों के बारे में आज जानेंगे। Hi, I'm Dr. Mansi Verma, your practicing gynecologist at Veera Health. I have 9 years of experience in obstetrics, gynecology, and laparoscopy. PCOS and its fertility-related complications I see on day-to-day basis, and I have vast experiencing of correcting it. Come, we'll understand what PCOS is all about and how to diagnose it. PCOS or polycystic ovarian syndrome is the most common endocrinological disorder we see these days. It's not only limited to reproductive age group, we see in young adolescent girls and even in perimenopausal and menopausal women. It's a most common metabolic and endocrine disorder where we see hormonal imbalance in two most common hormones, that is your insulin and androgen. As your insulin keeps increasing, it brings about changes which is seen as symptoms in the form of irregular periods, acne, facial hair growth, sudden weight gain, obesity and also difficulty in conceiving. So क्या PCOS एक मेटाबॉलिक डिसऑर्डर है जिसकी वजह से आपके बॉडी में इंसुलिन बढ़ता जाता है और ये इंसुलिन बढ़ने की वजह से होता है इंसुलिन रेजिस्टेंस। ये खाली ये सिम्टम्स कॉज नहीं करता, इसके अलावा इसके लॉन्ग टर्म कॉम्प्लिकेशंस भी होते हैं, जैसे टाइप 2 डायबिटीज़, ओबेसिटी, हाइपर कोलेस्ट्रोलीमिया, हाइपरटेंशन एंड इवन कैंसर। इसीलिए PCOS को जानना और समझना बहुत ज़रूरी है। PCOS को डायग्नोज करने के लिए ये क्राइटेरिया यूज़ किया जाता है। अगर 3 में से ये 2 सिम्टम्स आपके बॉडी में हैं तो हम लोग इसको डायग्नोस्टिक क्राइटेरिया के हिसाब से PCOS कंडीशन मानते हैं। ये 3 सिम्टम्स क्या हैं? नंबर 1, पीरियड का ना आना या पीरियड का इरेगुलर होना। नंबर 2, बॉडी में मेल हार्मोन की मात्रा बढ़ने की वजह से एक्ने, फेशियल हेयर ग्रोथ एंड स्कैल्प हेयर लॉस होना। एंड नंबर 3, अल्ट्रासाउंड में ओवरीज पॉलिसिस्टिक नजर आना। Remember, there is no one single diagnostic test. There is a hormonal profile that we do, which helps your gynecologist understand what type of PCOS you has and also helps in coming down to the root cause of your PCOS. Come, let me take you through the panel of tests that are done. Number 1, ultrasound. Women who show symptoms of PCOS are often asked to get a pelvic ultrasound. This is done in order to understand the uterus and ovarian morphology. The following changes what we see are: number 1, 20 or more than that follicles in the ovaries. Second, ovarian volume being more than 10 ml. If these changes are seen, we label ovaries as polycystic ovaries. However, what you need to understand is not all women who have PCOS symptoms will show these ultrasound findings, and not all women having these ultrasound findings will have PCOS. So, ultrasound can be used as a diagnostic tool along with the other clinical features. Number 2, testosterone and free androgen index. Testosterone is a male hormone which is produced in small quantities in female body, but in PCOS the levels increase. This primarily happens because of the insulin hormone, which increases the production of testosterone, because of which its value keeps increasing and it's responsible for your acne, facial hair growth and scalp hair loss. Hence, tests like free and total testosterone, free androgen index helps in determining the testosterone levels in the body and forms one of the diagnostic criteria of PCOS. Number 3, thyroid stimulating hormone test or TSH test. Hypothyroidism in itself causes symptoms similar to PCOS like irregular menses. In order to diagnose it, your gynecologist will frequently ask you to do a TSH test or a thyroid hormone profile. Number 4, prolactin test. Prolactin is a hormone which is produced by pituitary gland, which is a small P-shaped gland present at the base of your brain. Prolactin promotes lactation in women, and when its level increases, it can cause irregular cycles. Hence, prolactin test is important to rule out hyperprolactinemia, which is often a cause of absent or irregular periods. Number 5, female reproductive hormone test. This panel consists of FSH, LH and estrogen, which is commonly done in women who suffer from irregular cycles in order to diagnose causes other than PCOS, like early menopause or premature ovarian failure. LH to FSH ratio was earlier used as a diagnostic criteria, but now it is outdated. But still, this hormonal profile is important in women who are trying to conceive or who suffer from infertility. Number 6, insulin test. 70% of women who suffer from PCOS have insulin resistance. Insulin resistance doesn't let your body respond to this hormone and the insulin level keeps on increasing. That's the reason you see the symptoms of PCOS. This insulin is also responsible for increasing the testosterone level and hence your acne, facial hair growth and hair loss. Insulin resistance is also responsible for causing long-term complications like type 2 diabetes and hypertension, so it is imperative to diagnose it at the earliest so that it can be treated. If you think this diagnostic process looks complicated, Veera Health along with 1mg has come up with an easy solution of a simple, affordable, at-home blood test where a qualified technician comes home to do your blood test at a scheduled time. Once done, you can access your reports online within 48 hours and get a free consultation with a Veera gynaecologist. In order to know more about these tests, you can access the link in description.